All right, welcome back. If you suffer from chronic pain, depression, anxiety, there's a brand new groundbreaking treatment we want to tell you about. Dr. Worrich with Calypso is joining us right now, and it's Calypso Wellness Center, and they're all over the world, and they're here to help. So how are you doing this morning, Doctor?
Not quite all over the world, all over the U.S.
U.S. Sorry, my world's in the U.S., but, y'all are doing some groundbreaking stuff, especially when it comes to medicine these days.
Right. So what we're doing is we're using low doses of this medicine called ketamine, which ketamine is an old anesthesia drug. It's been around forever. But what we found is giving low amounts of this medicine through an infusion can have profound effects to benefit patients with pain, depression, PTSD, fibromyalgia.
Now you're talking about anxiety, depression, PTSD, different things and different symptoms, but how does that treat it? Like what does that do for these these patients?
Sure. So ketamine is a very interesting medication. It's not a narcotic, it's not like morphine, it's not like your traditional antidepressants. It works on a very specific place in the brain that's very important for how you perceive and regulate pain and depression and PTSD.
How does one go about thinking or maybe possibly knowing that they need possibly ketamine?
Sure. So if you're suffering from pain, depression, PTSD, and maybe what you've been going through with your other doctors isn't helping, you've been taking medicines, you've tried procedures, you've tried surgeries, you've tried therapy, and you're still suffering every day, this may be something that can be good for you.
Last month, August 2017, y'all made Time Magazine.
Yeah.
So what's that like? How was that?
That was really cool. One of my patients brought me the Time Magazine cover a couple weeks ago saying, look what's on the cover of Time Magazine. They did their cover story on ketamine as being the future treatment for depression, which was really neat.
That's got to be awesome because it educates a lot of people. A lot of people don't know what's out there.
Right. Some people have heard of ketamine, most people have not. So that's part of our challenge is first educating people on what ketamine is and what it can be helpful for.
No, I like that. Being that we're in San Antonio, Texas right now, there's a lot of veterans in and out. You talk about PTSD. That's one of the probably biggest things that people try to talk about but don't. How can we get more help for them to get them, should we just, kind of help volunteer people in and,
Sure.
Give them a direction?
We love taking care of veterans. We offer them discounts to get our infusions. We've had phenomenal benefit for PTSD. One of my favorite stories to tell patients and other doctors is about a Vietnam vet patient of mine who'd had nightmares every night for 40 years. Had one infusion, they were completely gone for a year.
That's amazing.
Unbelievable. So
with this ketamine, this is something that has to be in-house, and it's obviously watched over by,
Right. So it's 4 doctors that started this. We're all board-certified anesthesiologists. So one of us is always there while you have your infusion. You get an IV. You're monitored throughout the infusion. You'll be in the clinic for about 2 hours.
Okay.
And then you'll go home, and most people go home and go to sleep.
Well, that sounds like it's going to be helpful in the future and even right now. Doctor, I want to thank you very much, but let me give everybody the information for everything that they need to know. And right now in San Antonio, Texas, you go to Lock Hill Summer Road at 4600 Suite 108. You can also go to their website. You can go to their Facebook page. They are everywhere. You can give them a call, 800-RESET-20. All right, Doctor, thank you.
Thank you.
All right, coming up.